RN. Welcome back to Room 101 Health Spotlight. Good day to our viewers, fellow doctors, and medical students. Today we're going to have a very special guest. He's an Australian YouTuber who gives proper and precise medical information for the Filipinos. He is Doc Adam. Last Sunday, a man sent a video to one of our staff and his neighbor was asking for our help. The video clip will be shown on the screen.
Hello po, Room 101. The mother of my girlfriend called me 3 days ago about her condition. The doctor diagnosed her with rectocele, and her mother is still confused. How can she be able to prevent rectocele? And what is the reason behind the disease? Please give us information about her condition. Thank you.
Today, our topic will be rectocele, but first, let's take a look at the overview of this disease.
Posterior organ prolapse (POP), or mostly called as rectocele, is a herniation of the rectovaginal septum anteriorly of the vaginal wall. It involves the anterior rectal wall as well as a posterior aspect of the vaginal wall.
What are the symptoms, causes, and diagnosis of rectocele? It will all be discussed and answered by my partner, Dr. Daryl Banal.
Thank you, Dr. Gana. We're going to talk about the rectocele causes first. Rectocele occurs when the rectum pushes the backbone of the vagina forward, causing a prominent bulge into the vagina. Let me explain to you all more further. Some of the events that may weaken or thin the rectovaginal septum and cause a rectocele include vaginal normal childbirth, a long and difficult labor, tearing during childbirth, particularly if the tear extended from the vagina to the anus. Hysterectomy is an operation to remove the uterus. Pelvic surgery, chronic constipation, straining to pass bowel motions, advancing age as older women are more prone to rectocele. The symptoms of rectocele may be vaginal, rectal, or both, and can include a sensation of pressure within the pelvis, symptoms worsen by standing up and ease by lying down, lower abdominal pain, a bulging mass belt inside the vagina, vaginal bleeding that's not related to the menstrual cycle. For the diagnosis of rectocele, a doctor can diagnose rectocele using number of tests, including pelvic examination and special X-ray, such as proctogram and decagram. And now, we're all waiting for this. Please welcome Dr. Adam and with his special partner, Puto!
Hello! Ako si Doc Adam. Napapansin niyo naman, wala ako ngayon sa clinic ko, di ba? Kasi may pandemic nga, di ba? Sarado ang mga clinics, kaya dito muna ako sa aking bahay, sa aking house, at magbibigay ng advice sa inyo. Ngayon, pag-uusapan natin is about rectocele, the prevention and how do we treat it.
Doc, can I also get rectocele?
Are you stupid, Buto? Of course you can't have rectocele. May organs ka ba? Wala, di ba? The treatment depends on how severe is your posterior vaginal prolapse is. Your doctor might recommend first is observation. If your posterior vaginal prolapse causes few or no symptoms, simple self-care measures are needed, such as performing Kegel exercises to strengthen your pelvic muscles that may provide relief. Next is medical therapy. Patients with rectoceles may present with an asymptomatic bulge found during the pelvic examination or with a myriad of symptoms. For patients without symptoms, expectant management is recommended. Generally, treatment is determined by the age of the patient, the desire for future fertility, the severity of symptoms, the degree of disability, and the presence of medical complications. Pessary. A vaginal pessary is a plastic or rubber ring inserted in their vagina to support the bulging tissues. A pessary must be removed regularly for cleaning. Next is surgery. Surgical repair might be needed if: first, the posterior vaginal prolapse protrudes outside your vagina and is especially bothersome. Second is, you have prolapse of other pelvic organs in addition to posterior vaginal prolapse that is bothersome. The surgery usually consists of removing excess stretched tissues that forms the vaginal bulge and placing stitches or sutures to support your pelvic structures. A mesh patch might be inserted to support and strengthen the fascia.
Doc, can I share my natitirang knowledge?
Sige lang, buto.
Factors that may increase your risk of posterior vaginal prolapse include 1. Genetics, 2. Childbirth, 3. Aging, 4. Obesity, 5. Estrogen, 6. Other pelvic surgery.
And now for the prevention. In order for you to reduce the risk of having posterior vaginal prolapse, you can try this following advice. Performing Kegel exercises daily. These exercises can help you strengthen your pelvic floor muscles. This is important especially after having a baby. Avoid heavy lifting and lift correctly. When lifting, use your legs instead of your waist or back. In this way, you can prevent putting too much pressure on your pelvic floor muscles. That's all I can say. Buto, you can say goodbye to them now.
Okay, hahaha, bye-bye.
I hope all of you learn very well. See you next Saturday. This is Dr. January.
Dr. Daryl, and special appearance of
Doc Adam.
And Buto.
And the doctors are out.